What is the importance of training clinicians in how to meet the unmet needs of patients with dementia and their families or their family caregivers? The issue with dementia is it's a serious illness that affects patients and their family caregivers, sometimes known as their care partners. It's a long trajectory of that illness. From time to diagnosis to time of death, patients often live 6, 8, even 10 years. And so, there's a lot of burden on not just the patient, but the caregivers or care partners as well. And so we also don't get a lot of specific training on Alzheimer's dementia and how we can best support patients and families. We have 6 FDA-approved medications that target dementia, none of which really have a lot of evidence that they work all that well. And we know that caregivers are supplying millions of hours of unpaid caregiving. Much of that caregiving that they're doing it requires skills that they just have not gotten training in. So we have untrained folks with great intentions working themselves to exhaustion to take care of folks that are sick for, decades sometimes. So, what we try to do with the dementia training is to look at how do we support not just the patient by helping with symptom management, educating the caregiver on how to take care of them, but also how do we help the caregiver find the support they need in the community. So there's a direct correlation between, caregivers' stress and hospitalization and nursing home placement. So the better that we can educate our care partners, give them the skills, training that they need to help take care of their loved one or the patients with dementia, the better the care is going to be, the less suffering there's going to be, and the longer they stay at home. And what I really love about the CAPC curriculum when it comes to dementia is that it really turns on its head what we all thought we learned in our professional training about dementia. One of the big take-home points, and I think a huge take-home point of those courses, is that behavior is communication, that we don't need to be medicating dementia patients out of their behavior. We need to understand that that's their only way to communicate, and that we need to be looking for pain, we need to be looking for anxiety, we need to be looking for triggers that may be having them react in a way that we would describe as a behavior, when really all they're doing is talking to us in the only way they know how. And even helping care partners understand that is a huge part of the curriculum. Where can they find resources? Helping them understand the trajectory of the illness so that they're not surprised, and really giving them the support they need to be able to keep their loved one at home. Not all suffering is defined by skilled need. So, a lot of the things that people suffer with, just their needs aren't met. Those needs aren't met by the health system as it is. So, the palliative care team design of having social work and nursing and physician and chaplaincy really can support the caregiver to take care of the patient with dementia, because a lot of dementia care is about supporting the care partner or family caregiver, because they're doing the work.